I appreciate the opportunity to join you all today and applaud you for keeping your eyes on innovation despite the many challenges we face from the COVID-19 pandemic. These are truly unprecedented times. This pandemic has hit us hard, and like you, I've been focused on our response day and night. But today, I want to start off by sharing with you some of the work I've had underway long before COVID-19. Work that has only grown in its relevance and urgency due to the revelations and trauma we faced from the pandemic. On October 7th, I released the first call to action during my tenure as Surgeon General and the first in several years from this office. I'm issuing this call to action to improve control of hypertension or high blood pressure. Hypertension or high blood pressure is common, it's costly, but it's controllable. And yet control rates are low and stalled, especially in communities of color. Almost 1 out of every 2 adults in the United States has high blood pressure, and only 1 in 4 of us has it under control. And when I say us, I mean your Surgeon General personally. This is my blood pressure cuff that I use for my blood pressure monitoring and to know my numbers. We want everyone to understand that the new standards say that control means less than 130/80. Unfortunately, Black Americans in particular have higher prevalence, develop high blood pressure at younger ages, and suffer more organ damage than whites. This is again something I have personal experience with, having lost all 4 of my grandparents due to diseases that were caused or exacerbated by high blood pressure. We know that uncontrolled hypertension leads to largely preventable and now rising rates of heart attacks, strokes, kidney disease, heart failure, cognitive decline, and even maternal morbidity and mortality. Several of these conditions, largely preventable with good blood pressure control, further increase the likelihood of severe cases of COVID-19. The good news is that high performance in blood pressure control is possible no matter the setting or patient population. There are exemplars around the country, urban and rural, large systems and solo practices, many community health centers that have achieved control rates of over 80% with their hypertensive patients. And I'd encourage you to go to millionhearts.hhs.gov to see what some of these exemplars are doing. Our goal with this call to action is to make hypertension control a national priority and to spread the lessons of these high performers so that all Americans are protected from hypertension's harm. As leaders, you're always selecting and executing your organization's priorities. We are all focused on COVID-19 right now, and sadly, 200,000 people have died due to the pandemic in the United States. But we can't lose sight of the fact that over 500,000 people die every year with hypertension listed as a primary or secondary cause on their death certificates. So please read my call to action available at surgeongeneral.gov. Here's what it looks like in paper form, but you can get it digitally, and find the actions you can take. Join the national effort to bring our pressure down. I want you to know I will soon also release a maternal health call to action. As you hopefully know, more than 700 women die in childbirth each year, and thousands of women experience severe complications, so-called near misses. Over 2/3 of these deaths are preventable, and women of color suffer more complications and a much higher risk of dying. My call to action is designed to engage and equip a wide range of individuals and their communities and organizations with evidence-based actions that will improve maternal health and outcomes. We're using a life course approach, stressing the importance of improving women's health prior to, during, following, and in between pregnancies. We all have a critical role to play in improving the health of America's mothers and mothers-to-be, because I want to make this the safest country in the world to give birth. Third, I'll soon be putting out a Surgeon General's report on community health and economic prosperity, abbreviated as CHEP. The impetus behind this report is the observation that the health of Americans is not as good as it could be, despite the fact that we pay much more for healthcare than any other developed nation. This combination is what we call the U.S. health disadvantage. My report makes the case that health and the economy are inextricably linked, a point that's been powerfully and painfully made by the pandemic. The report offers ways for businesses to address the U.S. health disadvantage by engaging with and investing in communities while also creating value, lowering cost, and lifting up the health of employees and other stakeholders. In subsequent months, I will also release a call to action on suicide prevention and a full Surgeon General's report on oral health, which will be the first one in 20 years. Each of these are major public health issues, and I look forward to working with you on both of them. Working together closely and well resonates with the principle that guides all my work, my motto being better health through better partnerships. Because the truth is, we can't change our future alone. It is only through collective action that we can make sure everyone has an equitable opportunity to live a long and healthy life. An underlying theme throughout all of the work my office is understanding and addressing is health disparities and finding effective methods to advance health equity. This intention, again, has only been fortified through the pandemic. The reasons for this are many and are rooted in both medical and social pre-existing conditions that we are seeing conspire to reduce our resilience, our opportunity, and our health in the midst of an invisible enemy. Social determinants such as transportation, education, access to healthy and affordable food, and safe places to be active make individuals more susceptible to infection with COVID-19 and are also associated with more severe complications and death. And they contribute to additional medical determinants, chronic diseases such as diabetes, cardiovascular disease, kidney disease, and hypertension. The good news is that we're making progress in the structures, processes, and knowledge needed to fight this pandemic. As of today, the US has conducted over 120 million tests with a positivity rate of less than 5%. So while you're hearing about us trending in the wrong direction in many places, it's important to note that as a nation, we've driven our positivity rate down into the green zone. We've opened more than 500 community-based testing sites with the support of private sector partners and the US Public Health Commission Corps, along with many of you. 70% of these testing sites are located in socially vulnerable areas, and that is not by coincidence. We categorize socially vulnerable by housing situations, race, ethnicity, income, and language barriers. We also fund testing at 94% of America's community health centers, which predominantly serve low-income areas and communities of color. And HHS has allocated over $15 billion to Medicaid providers and $10 billion to safety net hospitals, knowing that they are sources of care for our most vulnerable. Beyond the testing work I mentioned, the CDC now requires that all testing data reported by states include information on race, ethnicity, and zip code, so we can better understand how to protect our most vulnerable communities. We've also deregulated telemedicine, making ongoing care for many medical conditions safe, accessible, and convenient, not just for millions of patients, but also for healthcare professionals. These investments are critical, but we're not stopping there. In addition to greater supplies of PPE and more available testing, I want you to remember, we also have a much better understanding than what we did 8, 9, 10 months ago of how to treat those who've been infected by this virus. Remdesivir and steroids, tailored approaches to ventilation, and more, many of which you have helped to innovate, have improved recovery rates and ensured that more Americans are safely returning home to their families. While this reflects important progress, I want to emphasize the most important contribution we can all make is by focusing on and promoting prevention of this miserable disease. The administration's emphasis on public-private partnerships is allowing us to progress towards a vaccine which will help prevent disease safely. But we're doing this at a record pace as part of Operation Warp Speed. We now have an amazing 4 vaccine candidates in phase 3 trials, less than a year after discovering a new virus. But we know that having a vaccine available is only the first step. Ensuring that all Americans have an equitable opportunity to receive the vaccine and promoting vaccine confidence will be key towards achieving degrees of herd immunity and ensuring the protection of Americans against COVID-19 so that we can put this pandemic to bed for good. So please continue your conversations with staff, patients, families, and colleagues about why vaccines are important, whether for measles, flu, or COVID. We know that the US vaccine supply is the safest in the world and the safest in history. And we need to encourage people to focus on the processes that are in place to ensure a safe and effective vaccine and to put the politics aside. I also ask that you help establish systems now to ensure patients and their families get their flu shot this year. You may have seen on social media that I've actually been going around the building and giving people flu shots as Surgeon General of the United States. Unfortunately, less than 50% of adults get vaccinated for the flu every year, and this percentage drops to 40% when you look to communities of color, Hispanic Americans, and African Americans. Reducing harm from flu will not only save lives and reduce suffering, but it will promote health equity and it will preserve healthcare resources, human and material, for COVID care. No one knows that better than you. We have about 7 million people who've been diagnosed with COVID right now. We had 35 million people last year who were diagnosed with flu. Imagine the havoc it's going to wreak on just day-to-day life if 35 million people or more are going around this season with fevers, with coughs, with colds, coming into your clinics, and many of them being admitted to your hospitals. In addition, the systems you put in place now to promote the flu shot will better serve your communities and organizations when the COVID-19 vaccine is ready to be administered. I call it a great opportunity to prime the pump. While we're optimistic about a vaccine, again, please remember our best immediate defense against this infection are these tried and true public health best practices that I call the 3 W's. Wash your hands frequently and thoroughly. Watch your distance, meaning stay 6 feet from others and avoid crowded indoor spaces. And wear a mask to protect others. The high degree of asymptomatic spread means wearing a face covering and physical distancing are an imperative, a critical individual behavior that will make all the difference in our ability to recover from this pandemic. Don't believe me? Look at New York. They were the worst in the world in terms of COVID infections. They were under 1% positivity rate for several weeks, almost 2 whole months. And they did it without a vaccine. They did it with my 3 W's, wearing a mask, washing your hands, and watching your distance. This pandemic has been an unprecedented challenge, but it is critical that we acknowledge how much we've learned in the last 8, 9, 10 months. We have to let the public know that we are making progress, because a lot of the pandemic fatigue people are experiencing is because they've been making sacrifices, because they've been doing the right things, but every time they turn on the news, turn on the radio or the TV, they're being told that things are getting worse. We have to help them understand that original projections were that 1-2 million people would die from this virus. Sadly, 200,000 people have perished, but that is much lower than what it could have been if you hadn't worked so hard, if the people of this country hadn't worked so hard. We need to remind everyone that we know so much more about who is at risk and why. And that's why our mortality rates have decreased from 30% at the beginning of this pandemic to less than 5% now. We know much more about how to treat those most severely affected. And that's why hospital stays have been shortened, and it's allowed us to flatten the curve. We know that we must address the underlying drivers of disparate outcomes, those social conditions that can either limit or unleash a healthy future. And most importantly, we know what works to keep people and their communities safe. And we've launched a messaging campaign called #COVIDStopsWithMe, because we all have a role to play in preventing the spread of this virus. I ask that you visit my Twitter account @Surgeon_General to watch the video I made and share it within your organizations, within your networks, and with your loved ones. I need your help in spreading the word that our health, our nation's future, is literally in our hands. Thank you so much for the opportunity to join you today. Please remember, the way we win the war against this virus is through individual behaviors. Simple, scientifically sound acts that absolutely have been shown to get us back in control of this pandemic. We live in an age of misinformation, and I ask that you, as trusted leaders, help spread the word that together we can defeat this virus. I remain steadfast in my resolve to use our lessons learned, our scars, and our losses as a once-in-a-lifetime opportunity to make our communities healthier, more resilient, and more just. Thank you again, and have a wonderful day. Get your flu shot and stay safe.